I'm going to do my best to try and explain to you why ultrasounds are not as safe as you think they are. If you go looking, there is actually quite a lot of research available, but it's a very difficult area to study. Before we go into the research, you have to understand that ultrasound is sound waves. It's not radiation like X-ray. It's made by sound waves produced by the machine that goes into the tissue and gets absorbed by the tissue. The sound waves have a mechanical effect, but also a thermal effect, meaning that they can cause tissue heating. And in a fully developed adult body, a few degrees here or there makes zero difference. But if you're talking about a tiny microscopic fetus with a developing brain and nervous system, it can be quite critical. This one's from 2007, so it's a bit older. This study found that ultrasound caused changes to the fetal heart rate and also vascular damage in developing bones. This paper is from 2016, so a little bit more recent, but they were looking at the brain surface heating after exposure to ultrasound. They also found significant surface heating after the ultrasound. We also need to talk about listening to baby's heart, because everybody says, why can't I listen to baby's heart rate anymore? This chart is looking at the intensity of the ultrasound waves. B mode is black and white scanning, so the regular ultrasounds. Then you've got color, and then you've got pulse Doppler, which is what we use to listen to the heart rate. And you can see that it is a lot stronger than the other modes of ultrasound. International Society of Ultrasound in Obstetrics and Gynecology updated the regulations many years ago about using the pulse Doppler in fetal ultrasound. Some of the studies found that there were changes to the developing fetal brain as a result of using the really strong pulsed wave Doppler. So we don't use it to check the heart rate anymore. We don't need to listen to it. We can measure the heart rate without using that function. They're advocating for the precautionary use of Doppler ultrasound in early gestation, not because they know exactly what it does, but because there's enough evidence to show that it is not as safe as everybody thinks it is. Ultrasound is not strictly regulated the same way that X-ray is, so people can do whatever they want, but that doesn't mean that they're doing the right thing. Research is ongoing. As we know more, we try and do better, because especially in healthcare, hindsight is always 20/20.